Thank you.
Yes. Huh? Camera's on. I don't think so. My computer closer if I need to. Should be there. Can you hear me, Shinichi?
Yes, I can hear you, Gary.
Hey, can you guys say something? See if you can hear us.
Hi.
You can hear our speakers okay now?
Yes. It's probably the best. Yeah.
Yeah, I moved the microphone a little closer.
Yeah. Great. Thank you so much.
You're welcome. We have about a minute to go till class starts. I think you guys are far enough away. You've got 10 feet, so if you want to take your masks off, you can, but it's up to you. Are you guys okay with that? If anybody wants to move, they can. Hello, Terrell.
Good morning.
How you doing?
I'm good. How are you guys?
Pretty good. Yeah, you can. If you talk, we can hear you. Terrell, this is Ron. How are you?
I'm good. How are you?
Look good.
Thank you.
We're going to do our introductions, the three of us first, and then we'll have you just briefly talk about the program.
Okay.
Is that good?
That sounds good.
Okay. That's when we're ready. Okay. Welcome everybody to my class. going with Dr. Mom's class.
Yeah, thanks you guys for letting us take over today. We wanted to share with you a really innovative tennis program that these guys have been working on that has a lot of relevance to therapeutic recreation, adaptive physical education, and working with young people. So today we have Ron Tankel. Let me make sure I get your last names right. Sorry. Michael-Ray Pallares. Yeah, thank you. And Leo Vega, right? I've worked with Ron for off and on through some conferences that we worked on together for many years, and it's a pleasure to have all three of you here on campus. I'm going to turn it over to you and let you introduce yourselves with a little bit more detail, and then we'll move on with the program, if that's okay.
Yeah, sure. Okay, well, I'm going to go first. So I'm Ron, and I'm a CTRS, and I'm now retired, kind of. And I did this for about 40 years with all different populations, adults, seniors, kids, pre-adolescents at a variety of places. I started out at the old Western Missouri Mental Health Center, which is in Kansas City. It's now called Center for Behavioral Medicine. Then I went to, are you guys familiar with Kansas City at all? Anybody?
Some of them are.
Okay. Then a private institution, which was, at Western Missouri, it was all adolescents for about 13 years. And then I was at Shawnee Mission Medical Center, which is a private institution, and that was for about 16 years. And they had 3 populations at the same time on the same unit, separate programs. I supervised for, I don't know, 20, 25 years or something like that. And then I decided that I wanted to end my career back with client contacts because I missed that tremendously. And I think that's where you have your most, well, you have a lot of impact. So I went Truman Medical Center, and I would think that some of you folks should be familiar with Truman Medical Center, maybe not. They have several interns there for therapeutic recreation on their inpatient units. And we had the first recreational therapy intern in my program, which was 100% outpatient. So her name is Peyton McGee. I don't know her married name now. She came through this program. She was your soccer captain here for the women's soccer team several years ago. And Lauren Farnsworth was there. You know, these names and Kristen Parrish, they're all married now. We had 3 or 4 RTs at one time in the outpatient program. And as far as the outpatient program went, they had never had a recreational therapist before. I was the first. So since then, they are now hiring all the time. Now, outpatient is a lot different than inpatient, for those of you who don't know. Our clients there were there every day. Some of them worked. Some of them would live in their own apartments. Some of them lived in group homes, whatever. And they would come there every day. So we got to see their progress every day. So I was national co-chairman for ATRA, for behavioral health. And that's how I met a lot of these folks at all the conferences. Sue, and I just saw in the hall. Terry, Sunichi, and I worked together for a lot. Sunichi came to, you guys know Sunichi?
They do not.
Okay, anyway, another professor was here. He came down and saw our program, was involved in that. And he's on there right now as he's in Japan. So this is now international folks. So that's my story.
Great. So my name is Michael-Ray Pallares. I'm from the Dominican Republic. I got a full scholarship to play tennis at the University of Alabama. I studied international marketing there, and then I played on tour for 10 years. I played all over the world. I traveled to about 100 countries. I played Davis Cup for the Dominican Republic, which is an international competition representing my country. And then after my time on tour, I began working with professional players as a coach, traveling with them to all the Grand Slams, which are the most important tournaments in tennis. I worked with the International Tennis Federation on a project called the Development of the National Sports Structure. So basically, they sent me to developing nations to set up the infrastructure at the national level, everything from coach education to high performance training to improvement of facilities and participation. So I did several projects, one in Panama, in Turkmenistan, Guam, in many other countries. And I created a foundation called Warmup Tennis. So I design programs and play days for at-risk youth and children all over the world, including in orphanages and such. And so the name is Warmup Tennis. And I did an event a few years back in Kansas City at the Salvation Army Children's Shelter. And anyhow, that was published in the Kansas City Star, and that's sort of how I got in touch with Tankel, how we started going with this particular program. But anyways, that's sort of a little bit of the background I have in tennis, and even into what we're doing here together today.
My name is Leo Vega. I am just a recent graduate of St. Leo University in Florida, bachelor's in sport business. I've been playing tennis for about 18 years at this point. I've been coaching about 20 point. I've been coaching about 8 years, various country clubs, sports academies, and high performance local tennis from there. And in January, I will start my journey as a professional tennis player, traveling the world. Happy to be here.
As far as questions, I need to say it's Terrell. Hang on just 1 second. If there's any questions, and we hope there are, we're going to save like the last 10 minutes for questions. That's okay. Have something you want to have answered, we're more than happy to do that. So I'm going to give a history of stuff, but before I do that, we're going to get Terrell on here. We have hooked up with this pilot program in Kansas City with Synergy Services, and Terrell works there, and he's going to give just a little brief history of what Synergy Services is, and then we'll go on with the rest.
I'll give you just a second. I'll try to give him on the big screen.
Okay.
Yeah, without taking down the entire setup.
While Terry's doing that, the person that took my place as a recreational therapist was also from the Northwest. She was inpatient, and everybody kind of wants to get over to outpatient because you can do a lot more. Obviously, I was the guy that took them out in public all over. Tennis, pickleball, you name it. So Northwest has a big connection between them. If you guys are looking for internships, jobs, or whatever, that would be a good place. If you need names or anything, email, just let me know. Okay? Just out of curiosity, who's a therapeutic recreation agent? Yeah. There you go. Now, do you get the little backwards? Do that.
Okay. All right, we can see now, Terrell, and hopefully hear you. Go ahead.
All right, perfect. Can you guys hear me?
Give me one more. We might lose our microphone on the track. Go ahead.
Can you hear me now?
You guys hear him back there?
No,
No.
try now, Terrell.
What about now?
Go ahead.
What about now? Perfect. All right. Well, thank you guys for having me. My name is Terrell Johnson. I am the Director of Youth Services here at Synergy Services. So I oversee a few of our youth programs on our campus. I'll start with Synergy House, which is our youth teen emergency shelter, which holds up to 18 beds for youth 12 to 18, youth that are runaway, homeless, or in crisis. Those youth can stay in our shelter for up to 30 days. The average stay is normally about 14 days. Youth do have the ability to come back. Once youth enter into Synergy House, we start discharge planning, and we're ultimately trying to, assess why they came into shelter and how we can help, overcome some of the challenges, whether that's, therapy or family therapy. Obviously we want them to reunify with their family if it's a healthy situation for the young people. The second program is our transitional living and maternity group home program. That program is an 18-month program for youth 16 to 21. Both programs, the transitional living and maternity group home, operate identical. However, the maternity group home is for pregnant or parenting mothers and or couples that are parenting or pregnant. That program is designed to, teach youth those life skills, teach them independence so that they can transition into sustainable housing once they leave that program. And our last program, it's kind of a split program. It's our Youth Resiliency Center, in addition to our Street Outreach program. Our Street Outreach program is designed to work with street homeless youth out in the community, provide them services, case management. We provide them food, bus passes, things that they need to be as safe as they can while being street homeless. A lot of times those youth don't want to be housed and they're comfortable being street homeless. So we try to take the harm reduction approach and make that experience as safe as possible. That team also does a lot of education in the community on synergy services, street outreach services, the YRC, to kind of get youth and community partners to be educated so that youth are aware of the services that we provide. And lastly, the program that has partnered with Ron and Michael is the Youth Resiliency Center, which is our community center, which is kind of the hub of our campus. It's where the Synergy House youth can access, our TLP youth can access. We have half-court basketball. We have a full art studio, full recording studio. We provide therapy groups. We provide life skills groups, some recreation groups. And what Ron and Michael have done in this partnership has provided a more in-depth recreational group for our young people and to help with some of the trauma that our young people have faced coming into this. So we're excited about that partnership and really grateful for Michael and Ron reaching out to us to give us the opportunity to collaborate. So yeah, that's our program. I've been at Synergy a little over a year. I started right in the midst of the pandemic. So quite the challenge early on, but things are finally coming around. And again, grateful for all the partnerships and relationships that I've developed over this last year plus. So again, thank you guys for having me.
All right. Excellent. Thanks, Trill. And we are actually working on some internship opportunities with Synergy. So if any of you are interested in that agency as a potential place to work in the future, touch base with me afterwards. I can get you hooked up with who to talk to there.
Absolutely. Thank you.
I'm going to try to switch it. Well, actually, can you guys speak and see if I can hear you okay? Real, can you hear me? Now.
I could hear you. Yeah.
Okay. I just want to add on to that. They do not have a recreational therapist, but that's true. They are considering. Yeah. So keep that in mind as well. And then, I'm assuming, correct me if I'm wrong, need a CPRS for the interns.
For the final internship, they have to have a rec therapist, but we do require a 150-hour field experience for several different programs. So there's other opportunities to go there and work and get experience, even though it's not your final internship if you are in the recreation therapy program.
There you go. Yeah. It's a good place. It's a great place to start, and hopefully they will hire somebody. Yeah. Okay. I'm going to go first. Yeah. So the stuff that I put up on the board, for me,
hey Ron, could you roll that board a little closer this way?
Yeah. Is good? You want me to push forward or what?
Yeah, just right there's fine. I can scoot over a little bit. Yeah.
move it this way. So my camera doesn't have such quite a long reach.
Got it?
Yeah.
More? Good.
No, that's fine right there.
Okay, I'll just read it. So I want you to remember this number. We're going to get back to 168. Anybody have any idea what that means? Private did. Okay, good. So be curious, not good now, right? Try to learn something new every day. This is huge. Every single thing is a choice. Everything. You chose to come here. You have to, right? Everything is a choice. This is my favorite. Everybody tells you to think outside the box. There doesn't have to be a box. Me, there never was. No such thing as problem or barrier. Only semantics. You think there's barriers or problems, it's going to be. This is what you want. This is a solution for. Okay. So now, I will give you a little bit of history, how this whole thing got built up to this point, and as we take over. So, when I started at Truman in the outpatient, they hired me as first recreational therapist. I knew a lot of people already there, so that helped, but they did not have any kind of physical exercise program at all. They said it probably wouldn't work because all the clients were motivated, sedentary, all that. That's exactly what I was getting here. It's going to happen, no doubt. So, we got started. I had been trying to get prior to that. Little different clientele there. You could do a group about wellness. You could talk about it. They would get it. I tried that when I first went there. It didn't work. We're just going to physically do stuff and talk about it at the same time. So we started doing everything. We were doing all kinds of exercise groups. I mean, I belong to the city center in Kansas City. I'm still there 7 days a week. I'm there all the time. We started doing bodies, we started doing yoga, we started doing body pump kind of stuff, all these classes that you probably heard about, maybe these places, all obviously 100% model. Okay, we had to get medical releases first. You couldn't just come in and these folks. This population that I worked with was 65%. 65%. That is a very high schizoaffective. There is a difference. I'm not going to be the one to sit here and tell you exactly what the difference is on those diagnoses. And these folks were very sedentary. Not only do they have mental health issues, obviously, but they have diabetes, hypertension, obesity, whatever you can possibly imagine. Every group that I was taking at the Jewish Community Center, I did with these guys. And I learned from those classes and modified. You have 30 people in the exercise class, everybody's going to be at a different level, right? They were able to do it. Gradually. Once it caught on, we had peers in there that not only came, but also started teaching the class. They were using my jokes. So that was even better because they were role modeling and they were showing the results that they got, whether it was weight, which it was an amazing thing to see them lose weight because all the medications that they're on. And, right? So they were doing it, they saw the peers doing it, Then, after 3 or 4 months of doing that, there was a citywide walking contest with about 7 or under 8 ages. Okay? Fortunately, we were the only facility that had a recreational therapist. None of these other places did. So we'd already been doing stuff. So you had 3 months, 5 really nice dollars. Okay? Keep track, we had to put in a computer, keep track of all this stuff. It was called 10 million steps. Well, that was supposed to be the total for all 8 agencies. Oh, we get 10 million steps. We got probably, I think, 12 million steps alone. Just stuff. That's because they'd already been doing stuff, right? And it worked. Once that did, they had a big
did citywide celebration, we were on TV, the whole thing. Then it really took off. Obviously, we were getting back. Okay. So then they stopped for about 5 years on that. Then we had another citywide thing. And this time, this is why you got to meet people where they're at. So you got 25 people. If somebody dropped out or got discharged, you could not add somebody else. Take away. First of all, they had donors, they had to keep them themselves. I was not going to hold on. We did not have one person lose their donor for 3 months, which for psych patients is pretty unbelievable and accountable, right? We did have one person actually washes, so dryer and wash, but he didn't lose it. So then, 5 years later, we did it again, and we had one gentleman that all he did was pace all the time. It's hard to go to groups. You need to be in this. You're going to be an all-star. This is not a joke. So we won again, whatever. This one guy who got first place in the entire city, he walked 2.3 million steps in 3 months. So I sat down and averaged that out. 33,000 steps a day. He talked about self-esteem. This guy, he got all these prizes, fun, TV, the whole thing. It was fantastic. So then, since things were going good, nobody got myself and an occupational therapist, we started a tennis court. And we used public tennis courts, right? Actually, the tennis courts that we use is now the one that Captain Combs is, where he's building, all of a sudden, bathrooms are getting fixed, courts were fixed, the fence was fixed. So it turns out that's what he has built. So anyway, we started doing that, and they were in shape, ready to do. So we started playing, and then I saw a little article in the Star about this guy over here, Michael, about coming to Kansas City and doing something for underprivileged kids at Lakeview Country Club. And I emailed him, thought I'd never hear back from him, of course, and I did. And Michael came down 2 years in a row, never had any experience with behavioral health for adults, kids, right? 100%. And so he fit right in. And he did some clinics with these guys in 2 years down there and went well. And of course, hey, this is all progressive, right? You start at the beginning. Build up. Good thing about the outpatient is the same clients every day. See all the stuff that's happening. He came down and did that. And then I retired. And Michael got my contact information and called me and we got started on this program for you. So that is kind of the history where we are today. Right? Okay?
Yeah, from my perspective, not having any experience in the behavioral health field, like I said before, I went up to Kansas City and I did an activity for the Salvation Army Children's Shelter through my foundation. There was an article published. Ron contacted me and explained to me what program he was running over at Truman. So he asked if I can kind of share my drills and activities. And I said, well, sure. I've never done anything like this before. I've worked adaptive tennis, wheelchair tennis. There's even blind tennis where they put a bell in the ball. And so there's, definitely different adaptive tennis out there, but never something like this. So I said, well, sure, I can give it a try and see how it works. And hopefully some of my drills and activities may help. And so I remember, not knowing what to expect, meeting Ron and the other staff over at Truman. They were giving me a tour around the facility. The clients were all waiting in the cafeteria, and I was sort of introducing myself. And I went up to one of the clients and I said, hey, my name's Michael-Ray. Nice to meet you. He just kind of looked at me for 10 seconds. And I thought, okay, this is going to be interesting. And he just says, oh, hello. I'm like, oh, hey. And so then he says to me, oh, don't worry, it's explained to me what, schizophrenia is. And, he said, oh, if you ask him who the 15th vice president was, he knows that and this sort of a thing. And so we're walking towards the facility and,
you can tell, you know, something's a little bit off, you know, for me, not knowing anything. I'm like, okay, we'll see what happens when we get there. And the first exercise that I thought of, I said, okay, guys, look, I want you to get in groups of 2, pick a partner. We're going to go the first 10 minutes rallying down the middle with your partner, and whoever makes the most shots in a row wins the game, you know? I wanted to gauge to see where they were at. And at that moment, they all locked in and they just started rallying, hitting. And so if someone had walked by at that moment and looked over, they would have just been like, oh, some adult clinic or something going on. And they would have not known, you know, like you were telling me, some are hearing voices and while they're playing and all this sort of things going on.
Oh, yeah.
But at that moment, they're focused in on the task at hand, and these sort of things help. And so, so that's when we continued working together, and we came to the USTA with this idea, the United States Tennis Association, to develop this pilot program for tennis and behavioral health, because we feel that tennis can be a tool to treat behavioral health issues. And so now we're working with a group of kids from Synergy, and we have them out twice a week for 8 weeks. And the first thing that we did was come up with a pre and post survey, so we can gauge where they are coming into the program and then where they are at the end of the 8 weeks, and see if there's any improvements. So that way we can collect data on that. And so we brought the survey with us to give you guys sort of an example of what kind of questions we were asking. Is there anything you want to add, or we can just go through some of the questions? So we made it quite simple, 10 questions, yes or no. You know, we could have gone through a 5-point scale, but we figured, you know, to keep it simpler for the kids, a lot of the kids are between the ages of 12 and 17, 18, I think, on the older age. So the first question is, I often feel isolated, right? I sometimes feel that my accomplishments are not meaningful. I have difficulty expressing myself appropriately. Okay? I often feel critical of myself. I have few activities that give me joy. I have difficulty interacting with others in a group setting. I am often not physically active. I have difficulty managing or structuring my time. I'm frequently unmotivated. I have difficulty maintaining concentration. And so these questions were designed touching upon 8 points that we felt were the most important points that we wanted to touch upon within the program, which we're going to go over now. And so at the end of these, the pre-test or the pre-survey, we're going to go and do a post-survey, seeing after the program, do you feel isolated, or are you still feeling that your accomplishments are not meaningful, and seeing if any of those answers have changes after the 8 weeks. Okay. And so the 8 points that we went through, I'm going to write those on the board. And so what we designed is, for a lot of these points, or what we call 8 steps for success, are tennis activities that focus in on that particular topic. Okay.
You're putting that up there. Of course. Okay, so interestingly enough, at this park, we had to work with Parks and Recreation to get the courts reserved. We had to work with the United States Tennis Association, who donated 20 rackets, lots of balls, nets, which you're going to see here pretty soon. We wrote up a whole behavioral health module for this, talking about some of these points, and we're going to be the first ones to do this with the United States Tennis Association. They do obviously have an adaptive tennis program for wheelchair and all of that, but this is the first time for behavioral health. And the timing actually couldn't be better if you're following sports at all, right? With Naomi Osaka, Simone Biles and all that. So the timing is perfect. The other little thing that I want to mention, which is pretty interesting. So they have learned how to play tennis. Our clients from New Frontiers, where I worked at Truman, keeping score, doing all this stuff. And we were playing at this park several years ago. And here we were with my mental health clients. 65% of them were schizophrenic or schizoaffective, right? And other diagnoses, obviously. And here is and I'm not trying to diss North Kansas City High School, but here's North Kansas City High School gym class over there playing tennis. The balls are flying over here. Balls are going to the fence. There's no instruction. And I went up to the coach there and I just said, just out of curiosity, is this a gym class? And he said, yes. And I said, are you a tennis coach? He said, no, I'm the wrestling coach. And I said, okay, thank you. And here are all my patients over here, completely structured, having fun, learning how to play the game. You see my point? Obviously, it was unbelievable. And actually, those kids that were playing stuff and were watching us, look what you can do, folks. You guys can do all this stuff. That's one of the points of this whole thing. We want you to come out of here inspired and motivated to do great things because you can do it. So, and also, we really weren't really that inflexible on the score. I mean, anybody play tennis in here? Okay, so one of the clients might, when it got introduced, then it was 70 to 50, 100 to 120, doesn't matter. As long as they're having a good time and they're learning, it's all good, right? So, okay. Michael, after you do the first one, right there, then I'll interject myself. Okay.
All right, so we started off with time management, right? So, and you can chime in anytime. So, okay, how to set a schedule to play. So, obviously, now that the kids know they have to be at the facility at a certain time, they know that hour from 3:30 to 4:30 set aside for tennis, what they need to do beforehand to be prepared, getting back to the center afterwards. Now they're learning how to sort of manage their time, which made it a task that they have been able to do earlier. Following through also on that is a huge one. So following through on that and doing it, not only one day the next day, but following through week in, week out.
So I'm going to interject. That is probably one of the biggest, whatever you want to call it, with the mental health clients is following through. Okay, has anybody done any wellness coaching in here? Or taken any wellness coaching classes? If you have not, the most important thing is, okay, I'm going to play tennis. To start, to say it, also to write it down, then to actually do it. But you want, instead of saying, I'm just going to play tennis, I'm going to play tennis at 3:30 to 4:30 at Mac and Park, and it makes people more accountable. There's research done. Okay, let me do that one other thing. Okay. This is every group that I did for years, I developed myself. I mean, I read all this stuff on anger management, did all these things, info plan. Well, it was good. It was good. You always get to check your own stuff. Okay, now it's time management, right? Got 168. Anybody know what that is now? Yes. Okay. You have 24 hours a day, 7 days a week. You have 168 hours. That is yes. Every single person do whatever you want, right? I don't know if that seems like a lot, not very much. 168 hours every week. You got to sleep, you got to eat, all that.
Then we touched upon motivation. So there are two different kinds of motivation, extrinsic and intrinsic, right? We want the kids to have an intrinsic motivation to come out and play. We want them to be the ones saying, hey, we can't wait to come out on Monday to play tennis, on Tuesday to play tennis. So, what kind of ways do we motivate, the kids to come out? Obviously, a great way is, sort of through role modeling, having other kids that are motivated and having kids join in with them. So that way they sort of feed off of each other. That's a very important key point for that. Also goal setting. If they know, hey, in 2 weeks, we're going to have a little mini tournament here amongst each other. We're going to do, some sort of task or tournament situation that they want to prepare to play, then they get motivated to practice to get ready for that. So there has to be some sort of goal there for the kids to come out and want to play tennis. So that was our second point there. Socialization. I mean, that's a big one. I don't know if you want to.
Yeah, I mean, obviously that's a big one. Most of the kids are isolated. To even do something with somebody else is a big thing, no matter what it is. And I can honestly tell you, so we've done this for 2 days now, Monday and Tuesday. And between the first day and the second day, They were a lot more animated, smiling, having fun. And, you know, that's a really big thing. One of the nicest compliments I ever got out of the 40 years was I worked with this one adolescent, and I saw him years ago at a shopping mall. And he came up to me and he goes, you know what, Ron? You taught me how to have fun. There you go. Because a lot of these folks have not had a lot of fun. So just in 24 hours, we've already seen it.
Everything that we do it based on games. So rather than having them come out and, you know, okay, so this is the forehand, this is the backhand, they're learning to play tennis, but for them it's a game. So, you know, it's geared in a way where they're just having fun. They're with other kids that are just, you know, classmates or whatever, and they're just in there having fun with their class. That's the way they need to look at it. And in the meantime, they're learning how to play the game. Skill development. So obviously, you know, they're going to be learning different strokes, different, you know, forehand, backhand, serve, volley, all the strokes we learn in tennis. There's different ways to go about it. We have a wall right by the courts. That's been a great tool for us. So they get out there and we have them hit the ball against the wall and try to see how many they can make in a row. You know, and everyone has their own, you know, goal in mind. We make, you know, we do it in teams as well. That helps a lot. You know, so they can learn how to guide the ball, placement, direction. And that's great. Physical activity. I mean, this is another big one because a lot of the kids, they don't really do much physical activity. And so obviously, you know, having kids that maybe haven't done much physical activity, we don't want to press them too much. And we do want to prep them a little bit before they get started. So we want them to not look at it as, oh, they're being punished and they have to do some physical activities punishment, but rather, again, it's, you know, they have a game, or maybe it's a task, or maybe it's you know, a goal that they're trying to improve upon. So we can you know, give a few examples, Leo, of sort of a dynamic warm up that we have them start off doing.
So basically, we kind of started off with there's two kinds of stretching: there's dynamic stretching and static stretching. Usually in physical activity, you want to start with dynamic stretching. Really, I can go through a couple of them right now. We usually start off with something very simple, kind of knees kind of thing, kind of popping up like your two knees. I like that. If anyone knows the dimensions of tennis court, we usually have two lines on the side. We kind of get that as kind of each exercise. So that's one. Another example is butt kicks, like this, butt or something like that, or a side shuffle, staying low like that. There's a bunch of them, obviously, but that's kind of the idea of dynamic stretching. You want to start in the beginning, so you can get that muscle in, you have some fun, a little competition, get into it, and bring the whole group together.
And so, as far as a fitness drill,
there's many ways. Like for example, we have sprints. Honestly, there's an example of that. And in the tennis court, we have service blocks. There's two lines. So we grab a racket. We did this yesterday, actually. So for 10 seconds, you can start in the middle of the box and you go and tap it, and then tap it to the other one. And that's how you kind of gauge the results, by how many taps they have or how fast they're able to sprint. Or you can have a relay race with a ball in your hand and hand it off to the person. There's many drills you do, but the whole goal of it is kind of bring competition to it, but make it fun as well.
So for the example on that one, where they have to run back and forth touching the line, yeah, you know, if you say, okay, 10 seconds to see how you do. We had them all doing it at once, and then, okay, how many did you get? 7, 6, 7, 6, 8. All right. So right now he's the leader with 8. Let's see if you can all improve upon your number. And we did it again, and most of them improved. So they were doing it harder, and faster, and with more energy. But for them, it wasn't like they were just going out there working on, you know, fitness. They were just trying to beat their number, you know. So for them, that was sort of a game, if you could call it, you know. And yeah. So then, as far as stretching, let's do a couple stretches. So we'll get a couple. Two volunteers. Anybody?
Come on now.
Anybody? All right.
Ready.
Yeah. Do it. All right.
One more. Oh yeah, we need at least two. on, folks.
So we'll do a couple of dynamic stretches. We did or static stretches. We did dynamic to start. So we'll start with you. We'll do left over right, and then we gotta try to, without bending your knees, get down as far as you can. So right about shoelaces. You get shoelaces. All right. There you go. So then we sort of gauge that, and then as the ADs go along, maybe he's touching his shoelaces or touching his feet. Yeah, okay. Now I got to go with you. So and then right. So we're going here, and now we want him off underneath. Let's see. Very good. Very good. So he's touching. Nice. So you'll see the other side. Left. And so this one's a little bit right. So then we just be working on that, trying to see if the gap closes. So simple things like that, where a stretch, it doesn't want to stretch. So we're like, oh, you almost got it, or yeah, I didn't touch it before, but now I can. And then that touches upon a lot of these things. That would be what? Self-esteem, which we're getting to, and a lot of these other points. Because a lot of them sort of intertwine with each other. Right?
Yep. We're trying to integrate the whole person. So why don't you do a couple little?
Let's do.
All right. So we're the drills. We got about 5 minutes.
Yeah. Focusing concentration.
While you guys are getting ready for that, so I think the very first day, one of the things Michael had him do was, take the racket, bounce the ball up in the air without dropping it. This is not a joke. How many times that kid do it the first day? 350 times without the ball dropping on the ground. Okay. Yeah. It's amazing. Well, we need two people, folks. Gotta have 2 people, folks. Folks, this is the interactive part. Okay? Yeah, oh my gosh. The rackets are different sizes, so that was specific to younger, older kids, right? That's how the USTA does it. Then if you are an adult, they've got a bigger racket on it. Yeah, there you go. Oh my God. Try to keep it on the sweet spot. That's that little thing right in the middle. There you go. Oh my God. Yeah. Woo! Extra credit for these guys. Nice. These guys have been practicing. Look at that. That is impressive. There you go. It'll definitely help your guys' grade, I'm sure.
360 more to go.
That's a lot. Very good. Very good. Very good. Very good. All right. So, racket on the ball. There we go. On the line. Side to side, that's fine. So, we'll practice round. We're going to get to that table and balance it. So, hold it in your hand. There we go. Nice. All right. So, now that was pretty easy, right? Now we go back to ready? Go. Oh, look at wow. Unbelievable. Woo. Nice. Very nice. Oh yeah, you got to do the flip. Nice, nice. Pretty good. Yeah, oh, look. See how they've improved, folks? Look, it's unbelievable. 5 minutes. It's obviously coaching. Obviously. Yeah, and yesterday, these guys, in between the drills, as the balls went other places, the kids on their own without any prompt were doing that, coming back after they retrieved the ball. So they are definitely getting it. Okay, we're gonna do the this is not easy. Oh my God! Nobody does it on the first time, folks. Oh my God. That was impressive. I tell them about the one from yesterday where they couldn't hit it over.
Yeah.
So that's good. This is really cool. Yeah, this is good. Yeah. And then I think we probably, Michael. Yeah, we got to get the questions. So. This is a good. Yeah. So this is just showing how we have modified it because we want everybody to have success, right? That's the goal of the whole thing, make it successful in whatever form. Or meeting the client where they're at. Right? So we started off and
maybe I've said, okay, we want to, most of our road without mistakes. A lot of the kids were having a lot of trouble with that. So then we made a regression. So I said, you got to stop the ball and then hit. So I basically, it would be like something like this, Yep. And then they kind of like,
with much better results.
And then hit it there. And so then they were able to control a little bit better and get into more of a rally, right? And so that's a good example of regression or regression. So we started with the rally and we were able to do it. So we made it a little simpler so that if they're able to do the rally, then maybe we put an extra count. Instead they have to hit it cross court, and so now it has to be forehand specifically there. So it made it a little bit harder, right? So you can always progress or regress, right? Does anyone want to try? Two people to come up, rally. Anybody?
Teachers, students.
Why don't we? These guys have a class that starts at 11, so we can do that at the end. If somebody wants to come up and try it, and they can capture questions. If you are tight to get clear across campus or something, you can slip out. That's okay. If you can stay and ask some questions, that's great too. Okay.
You've been dying to ask a question. For this program, that's determined by the facility that we're at, this particular one. And they have to get parental permission. So once they do that, then we're in lots of confidentiality. We had to sign a bunch of stuff. We had to go through a little volunteer organization, all that stuff. They have, I don't know if Terrell mentioned it. If he did, forgive me for repeating it. They've also partnered with big brothers and big sisters. So there's going to be more and more. And we have already adjusted our program because they have to bring them from their facility after they get dropped off to the park. So while we were meeting with them yesterday, I said, what if we do one of the days here? That helps. So we're going to get, not only will we get more because they're going to hear all these people in the gym there, and we can obviously do these drills inside, right? So we'll get more people like that.
Yeah.
Does that answer your question?
Yeah, Synergy has multiple levels of service. So they actually have a residential section where kids who are actually homeless live there, and teenagers basically. Some of them actually have their own children, but they're still involved in that program. And then others, it's a drop-in program throughout the day. So they have like an open recreation area where they can come in and sign up for programs, kind of like a community center, but they'll go out and pick kids up who are homeless and bring them in so that they can spend time there. So they recruit their participants through their programming and then they refer them to you, correct?
Yes.
Yeah.
Now, when I was at Truman, when the clients came in for their intake, they signed it.
Another question?
Good question. At this point, this is just our own little thing that we're doing. However, we're going to Pittsburgh State on Friday. So I've already talked with one of the graduate students there with Laura, professor down there, and she is interested in taking this. She's going to maybe do her thesis on this. So there'll be a lot more research, a lot more data, all that kind of stuff coming from
And one thing we did do is, you know, we took notes of their times, their stretches, their ability, so that way after 8 weeks we see how much they've improved actually on it.
I just have one other little thing to add before we have the questions. But has anybody been to a conference, any kind of conference at all? Okay. If you go, it's a great thing. If you go, don't just stay with your little group. You got to get around and network. That's how I met all these people. I was all over the place. You know, I went to a session, whatever I got out of the session, I would go and find that professor. I would email him afterwards if I liked it, was interested in it. I would actually email or find out about it before the conference, you know, and read all this stuff. I mean, if you go to these conferences, you're going to learn so much and meet so many people that are doing so many amazing things. And recreational therapists are really good at sharing this stuff. Really good. It's not like, this is mine, you can't have it. This is mine, I want you to have it. So go. You just won't believe it. So, other questions? Well, you know what? I just read something on the way up here. Interesting enough. A poor coach will make you do something. A good coach will make you want to do something. Great. I just read it on the way up here. I don't even know what I was reading, but I read it. And that says a lot, right? You know what? If you can get one kid to do it or one person do it, they will all start doing it. You know, it just happens. And you have to roll model. You got to walk the talk and all that stuff. You know, you got to just get right in there with it. You can't sit there. You do this. You got to be involved. It's all together. Everybody's in the same boat. Does that make sense? Yeah, and it works. Believe me, it works. It's not easy, but it works. Other questions?
Thank you guys for your time today.
Yeah.
If you need to slip out, go right ahead. It's okay. If you want to hang out and visit, that's fine. That's great. You can hit the balls around, whatever you want to do.
Anybody wants email, phone numbers for us? Whatever you need. Guys.
Hey, Ron, what's your email? I'll type it in. I can't remember.
Okay.
Do you, if you don't want me to put it on here, I won't.
Oh, no.
On the chat? Okay.
No,
It's Terry, right? Yeah. Yeah. Gmail.com, right?
Thank you, folks. Thank you.
Hi, how you doing? Yeah. Yeah, I think it would work. Yeah, for the field experience, definitely. And actually, they have an interest in developing. Actually, let me stop the recording here. So.